we're starting today, I just wanted to mention that this morning I read something where St. Peter was saying that anything that controls us, we're a slave to. And I thought, oh wow, isn't that true of allergies? And I was so glad for the encouragement that Peter said. He says, you know, and I'm so glad that we have medicine to help with this, but God has given us everything we need for life and for, what's the other word? For life and godliness through our knowledge of Him. And our medical people keep seeking out that knowledge that helps us, and I really do appreciate it. And I thank you all for coming today. It's a delight to have you. So Dr. Bennett Radford is a diplomat. What did I do with your card, Doctor?
Oh, that's okay. It's on the...
It's a lovely little card. And he's a diplomat of the American Association...
American Board of Allergies.
Board of Allergies, Asthma, and... Immunology. So let's welcome Dr. Bennett Radford.
Thank you. It's a pleasure. Can you all hear me? It's a pleasure to come to present some information to you today about allergies. I'd like to present it in such a way that you would all understand what I'm talking about and not get into the very technical terms that physicians are prone to use sometimes when talking to their patients. First of all, as an overview, we're probably going to talk about what allergies are and the different conditions caused by allergies, what a medical exam would be like when you come in to see the allergist and the tests that we do, and then we'll talk about things you can do in your home to control allergies, as well as other therapies that are available, to include medications and the possibility of allergy immunotherapy or allergy shots. So, what is an allergy? Some of us are affected by allergies, and some people aren't affected by allergies. It all depends on what our DNA is, and what we've gotten from our parents and what we give to our children, and that's in the form of the genes that we pass on. When we come in contact with these foreign small proteins that are in the air, some people have reactions to those, other people do not. If you have a reaction, we all make this antibody that's called IgE. And this IgE antibody is very specific to those proteins that we're exposed to, the foreign substances that come into our bodies. And that IgE is usually rapidly taken out of our system or metabolized out of our system within 13 to 18 hours. However, if you have the gene, then there's a cell in our body that's called the mast cell, M-A-S-T, mast cell. And that mast cell lives in our nasal mucosa, it lives in our linings of our eyes, of our lungs, in our skin, and sometimes in joints, and gastrointestinal tract. And if you have you're genetically predisposed or have the gene to have a receptor site on that mast cell, then this IgE antibody goes to that mast cell, kind of like a lock and key. So keys are specific for certain locks, and there's a specific receptor on that mast cell that is specific for that IgE antibody. And that IgE antibody then will go and attach to that mast cell. Now the mast cell is a long-lived cell in our body. And so the mast cell, that every time we get exposed to a foreign subject, a foreign protein, then that mast cell, the body will make the IgE and it will go to the mast cell until that mast cell is saturated with IgE. Then you start to get exposed again to something, one of those foreign proteins, or allergens they're called. Then your body will respond. The mast cell will release its mediators. These are chemical messengers that are released from the cell that cause all your symptoms. Itchy eyes, runny nose, coughing, increased mucus production, chest tightness, wheezing, all from these mediators or messengers that are released from this mast cell. And the common things that trigger this mast cell can be pollens. That could be tree pollen, which is going on right now. And then mold spores. Since we've had a thaw, it's thawed out now, the molds is going to flourish, and the mold spores are floating in the air for us to inhale. When the cotton starts flying, people sometimes relate to, when that cotton's flying, that's when my allergies start up. And they relate it to the cotton. But the cotton that's flying is the flower that's produced. So you're not allergic to that. There could still be some cottonwood pollen on there, but that's usually the trigger of grass season starting. And then the grass will pollinate until it gets really hot in the summertime, late July, August, then the grass kind of goes dormant at that time. And then the weeds take off. And then we have weeds that go until it freezes. So the weed pollen's around. So if you have problems with trees, grass, weeds, you're going to have spring, summer, fall allergies. The mold spores are year-round, and usually during the warmer times. When the only times a mold is not a problem is when it's absolutely frozen outside. Then indoor allergens include animal danders, dust mites, and again molds. To go back a little bit to the outdoor allergens, I need to mention, because we are in Kansas, and the agricultural industry is very strong in Kansas, we do have wheat, corn, milo, sunflowers, as well as alfalfa. And the alfalfa, they cut that as many times as they can during the year, usually 4 or 5. They usually cut it at the peak time of pollination for alfalfa. So alfalfa can be a bad allergen. And the wheat correlates with the grass. And the corn usually correlates with the time that they're harvesting wheat, then the corn's starting to pollinate. And so there are several peaks throughout the year where the pollen load or allergen load is much higher, and that's usually during harvest times. So what are the typical problems that you get with allergies if you have allergies and you're so prone to allergies? Allergic rhinitis, or hay fever. That's where your nose gets itchy, runny, you sneeze a lot, and it can cause your eyes to get itchy and watery. It can also make your ears itch a little bit. Again, those are commonly from those things we just talked about. Trees, grass, weeds, molds, cats, dogs, other indoor things, dust mites. Asthma is another problem that you can get with having allergies. And again, the same cell is involved releasing those mediators. And asthma symptoms, wheezing, coughing, shortness of breath. Other symptoms or problems that you get is eczema. And many times that shows up in young kids. They'll start to get the dry skin patches that are very itchy. And then there's a tight correlation between eczema, asthma, and from allergies. And the eczema, of course, is you get the dry, itchy, scaly skin. And sometimes you get little blisters on there too, and it can really be a nuisance. If you've had eczema or know anyone that has it, or any of your kids or grandkids have those, you'll know. Another condition is called urticaria, or hives. And hives are those welts that you get. They get really itchy sometimes. Usually occurs sometimes after eating certain foods, shellfish in particular, or tomatoes or nuts can sometimes cause the hives to show up. And then the biggie, which nobody wants to have, and that's an anaphylactic reaction. And that is a full-blown allergy response to something. Whether it's something you ate or something you've been exposed to that you're allergic to. And when that happens, you can get tightness in your throat, difficulty swallowing, you'll get feeling red and hot and itchy all over. You can get abdominal cramping and just feel bad, and sometimes in women it reminds them of having menstrual cramps. So, and then your blood vessels dilate and your blood pressure goes down and you pass out and you have this feeling of impending doom. And nobody wants to have anaphylaxis. If you have anaphylaxis, you definitely need to report that to your doctor and have that further evaluated. Now, where do you go to get your allergies taken care of? And let me just interject here that if you have any questions, you feel free to interrupt me anytime. I'll be happy to answer those. But we'll also, when I finish up here, I'll leave ample time for questions and answers.
Dr. Bennett, that word anaphylaxis, is that related to the symptoms you just described, or is there more to that?
Well, it's a mass release of those mediators that we talked about. And there's mast cells all over our body, as I talked about. And they all seem to get triggered to release their mediators at once. And when that happens, then you get the massive flow of those mediators into your system, and your body tries to respond to them the best they can. And that's, and so many people will pass out when that happens because the blood vessels are dilated, and so the blood's not getting to the brain as it should, so you faint, and when you get into that lower position, then the blood starts getting back to your brain. But when this starts happening, it's a cascade that just continues, and we need to stop it somehow. And that can be stopped, and we'll talk about that.
From my nursing perspective, I had the impression that it could be life-threatening.
Oh, it will kill you.
Can. Yes.
It can definitely kill you if it's full-blown and doesn't get stopped.
Thank you.
Can you develop an allergy later in life? You can go all through life without it, and then boom, suddenly you're...
Well, I'll be happy to talk about that right now.
Oh, okay.
And what happens is people think that, well, I haven't had any allergies all my life.
Right.
But genetically speaking, you have that receptor site on your mast cell. And that mast cell is long-lived in our body, as I mentioned. And over time, you're collecting these IgE molecules attaching to that mast cell. And then at some point in our life, you get re-exposed to that, and then you start to notice some symptoms. And you may have had just mild symptoms all your life and just live with them and you don't think anything about it. Say, oh yeah, that's just my summer cold or something like that. But then once the cell has been triggered to release some mediators, you've reached the threshold. And you're at that point primed. And after you've been primed, it takes less and less exposure to those things you're allergic to react to them. And that's what happens, with age. When we're very young and going through puberty, especially, there's a lot of hormonal release going on. And a lot of those are steroid-based hormones that will protect us from allergies sometimes. And so sometimes, usually when you're young, you have allergies, and then through adolescence, many times, your allergies go away, or you feel like they go away. And then as you get older, third, fourth decades of life, sometimes later, they start coming back. And so that's how that occurs. I hope that makes sense to you.
Yeah, but there's another question I have right there. My grandson, when he was a kid, like 8 or so, he was diagnosed with asthma. But he has no problems now.
And sometimes when you're younger, it has to do with the anatomy of your airways too. As you grow, your lungs enlarge, and your bronchioles and bronchia, the tubes that carry air to our lungs, they grow along with that. And when you have more space there, so to speak, then you're less affected by things.
So it could go
But
either
sometimes
way.
that could be a hidden danger too, because you can have underlying things, and you get the right exposure, you could have an asthma attack. And asthma is nothing to fool around with, because it can be the silent killer. And so if you've ever had any type of asthma attack, coughing, wheezing, shortness of breath, after an exposure to something or with exercise, you should always have a rescue inhaler available. And that's a short-acting bronchodilator, it's called. Like albuterol, I'm sure you all have heard that, or which is generic for Proventil and ProAir. Those are forms of albuterol. They're little meter-dosed inhalers where you shake it and you inhale it at the time of attack. So if you have any asthma at all, you should, no matter how mild your asthma is, you could have an attack sometimes that could be life-threatening. Now, when you go to see your doctor, he's going to ask you questions about, well, what's been going on in your life? Is there anyone in your family that has these type of symptoms? And that will lead you more into that it is a genetic process that's going on. They'll ask you about your home environment, if you have carpeting, have central heat, air conditioning, if you have pets in your home, if you notice mold growth in your home. All those things are all part of the questions that are asked during your evaluation. Also, we want to know if there's seasonal variation to your symptoms. If you have it, springtime's the only time it bothers me, or it goes all through spring, summer, fall, or really doesn't bother me until I close up the house. Also, we want to do a physical examination where we'll look at your eyes, ears, nose, throat, and examine your abdomen, and also sometimes have to do some x-rays, mainly sinus x-rays if you're having symptoms in the facial area. Sometimes chest x-ray is needed. And then your doctor will probably prescribe you some type of antihistamine if he thinks that's appropriate, or a decongestant sometimes will help, and a nasal spray. Those are the three main treatments for allergic rhinitis. And if the medications aren't working, or you seem like you're having to depend on your medicines all the time, or you're having repeating problems, and the two things that we worry most about with allergic diseases, especially the airway diseases, is are you having asthma or do you have trouble with sinus infections? And if you're having sinus infections and asthma, that you're having to go on antibiotics frequently for your sinus infection, or having to use your rescue inhaler too much to me is using it more than twice a week, or having to get up more than twice a month and use your inhaler, or if you're having to refill your rescue inhaler more than twice a year, then you probably need to be evaluated and find some more effective controller medications. So when your family doctor or internist or pediatrician has evaluated you and seen you back several times, things aren't working, then they'll refer you to an allergist. And that's when I come into play. And so we go back and do a more complete history about all your environmental things and sinus infections and asthma attacks or skin problems that you may be having, gastrointestinal problems you may be having, all could be associated with your allergies. And then we will do what's called skin testing. And the first thing we do is called a prick skin test. And we will typically will do those on your back. And those are where we introduce a small amount of a tree, grass, weed, mold, dust mite, cockroach, feathers, wheat, corn, alfalfa, sunflower, pollen, and smuts and rusts, which are molds that get on the crops. And we introduce that into your skin through a little tiny puncture. And I know there's some of you in here that's had that done. And we also do a positive control and a negative control. Our positive control is histamine, which is released from that cell, so everybody will react to histamine unless you're on an antihistamine. That's why I have you off antihistamines 3 days before we do the skin testing. And then we measure the welt that you get and redness that you get at that side of the skin test, and compare that to our negative control. And if it's greater than our negative control, then we can safely say you are making IgE antibody to this particular allergen that's floating around in our environment. Now, if those are negative, sometimes we'll then go back and actually inject a little bit right under your skin of much more diluted form of that same protein. It's called the intradermal skin test. And if you all have had like a TB test done where they inject under your skin, that's similar to that. And we do that in the arm, and we'll inject different type of allergens there to see if you react to those. And if you do, then you're making antibody, IgE antibody, against the things you're allergic to. Then we can more specifically tell you the things in the environment that are troubling you, and then we can design a treatment plan for you and go over things that will help you control the allergens in your home. And so that's the next thing I was going to talk about, what you can do to control allergens. And I mentioned dust mites, and dust mites are very prominent in the dust. Every house has house dust mites in it, no matter what you do. And the things you can do to lower the burden or your exposure to those dust mites is, first and foremost, is your bedroom, where you have your pillow, mattress, and box spring that needs to be encased. If you're allergic to these guys, you have to have that encased in something plastic or vinyl with a zipper. And they have some pretty fancy ones out now that are plastic and vinyl lined on the inside and have a satin feel on the outside if you like that. The next thing is the carpeting in your, if you have carpeting in the bedroom, ideally you need to take it out of the bedroom, but most people don't want to do that. So there are some things you can spray on the carpeting, a tannic acid solution, that will actually denaturize the protein or make it inactive, the protein that the dust mite makes. Other areas of concern are like Venetian blinds, and you keep those cleaned, where the heater duct vents blow into the room, because you can get your ductwork clean, that helps, but there's still a lot of it still in the ductwork. So the best thing to do is some type of filter device where the air conditioning and heating blows in through the ductwork. And that can be done simply with some cheesecloth and changing that every 1 to 2 weeks. You'll see how much is actually coming through there, and that makes a difference. Another thing you can do, especially in the bedroom, is a high energy particulate filter, a HEPA filter. And it's a room purifier, air purifier. And you got to make sure it says HEPA on it, H-E-P-A. If it has that on there, then it's going to pull out most of the allergens that are in the air, to include dust mite and animal dander allergens.
It's a separate little machine?
It's a little machine, just set it in the bedroom.
They make a really big difference. I have one upstairs and downstairs.
Yeah, that does make a difference. And some people can even, you can do a whole house type of air recirculator that helps to pull things out. It pulls the bad air out of the house, it pulls the good air in, and filters it, and that helps a lot too.
Where do you buy those?
Well, you can, the whole house ones?
Any of them?
Well, there's allergy supply warehouses that have these, and I should have brought that along.
Seniors was carrying them too. Okay.
But,
Seniors was carrying them.
I got mine at Lowe's.
Yeah, they have them around. Just make sure it says HEPA,
HEPA.
H-E-P-A. Then you know you got the high energy or high efficiency particulate air cleaner.
Yeah.
Now, the other thing are pollens. You know, those are hard to avoid. You know, they're out there blowing around. You go outside, you're going to get exposed to it. But to try to keep them out of your home, try to, during certain pollen seasons, trees, grass, weeds, and those are the three biggies. If there's one season that you have most of your trouble, that season you should probably keep your windows closed and use your air conditioning. Sometimes if you just run your central unit on the fan, then you're kind of cleaning the air too, and that helps. Also, if you still do any laundry and hang it out, you know, it always smells good to hang the laundry out, but that's collecting a lot of pollen. So I would avoid doing that. And when you're out doing things outside and you know you have those allergies to trees, grass, weeds, molds in particular, if you're mowing or doing anything outside, raking leaves, composting, all those things, gardening, you should probably wear a mask, because that's going to help prevent that from getting into your respiratory tract and prevent a lot of your symptoms. Animal danders can be bad. Cats and dogs, cats in particular, are the worst. And most of the allergen that you find in those animals is through their saliva and urine. And so they lick themselves and they get it on them and then they deposit it wherever they go. That's why cats are so bad, because they roam and go everywhere and deposit that stuff wherever they go. There's actually been studies done that looked at cat protein. They've looked at houses at all socioeconomic classes and did not have a cat in their home. And every one of those homes had cat protein in it. They also did a study where they looked at a remote deserted island that's never had any animal life on it at all, and they found cat protein on there. So the cat protein does get in the Gulf Stream probably and just gets carried everywhere and deposited. So cat is one of the most prominent allergens out there, and if you're allergic to cat, you need to be on some type of medication or something to control that. Other things that mold spores, again, you probably can find those anywhere in your indoor molds, or where there's dampness in your home, around windowsills, in the bathrooms, under kitchen sinks, under your refrigerator where that evaporation trap is, and you pull that out and you'll see all kinds of things in there.
If my son seems to maybe have some of these things, and we leave, can these things get worse by not treating them?
They can, yes, because it takes less and less exposure for you to have symptoms. Once you're prone to those and you're genetically predisposed to react to those things. So allergens are they're definitely can be a life
No fun, right?
threatening at some points, but more likely to be life interfering type of problems. And when your life's interfered with, you don't like that, so you want to do something about it. So with the mold spores, getting back to that, I always try to dry your clothes right when you put them in the dryer, because sometimes molds get started there. And again, those areas in your house, you want to look for any growth of molds and clean that with bleach. That's the best thing to kill off the molds. Outdoor molds is a little more difficult, especially in Kansas. None of the farmers are out there cultivating or disking or doing anything in the fields. The mold spore is flying. And of course, we get a little breeze around here once in a while, so it carries that everywhere. But right around your home in particular, be careful of where you have like a compost pile. Keep that away. If you're a gardener and have a compost pile, keep that away from your windows. Try to keep the leaves and debris raked up when you can. And that will kind of cut down on some of the outdoor mold exposure. Now, going back to dust mites once more, I just wanted to tell you a couple of other tricks, especially if you have small children or grandchildren and have a lot of stuffed animals. Sometimes those can definitely be dust mite attractants. So what I recommend you do with those is throw the stuffed animals in a hot dryer for 15-20 minutes, and that kills off those dust mites. And in the colder countries, Scandinavian countries, they sometimes will take their mattresses, pillows, box springs, stuffed animals, and they'll take them out and leave them outside overnight. And it freezes everything and kills everything off. So that was another little trick.
What did you say you could spray on the carpet?
It's a tannic acid solution.
Okay.
And if there's a tanner around, sometimes you go down there and get it from them.
A what?
A tanner,
Oh,
somebody
okay.
does the hides and things like that.
Okay.
Now, when you go on medications, those are to control your symptoms. And what we're trying to control there is those mediators that are, or messengers that are being released. We're trying to protect the end organ, or that'd be your nose, your eyes, your lungs. So we want to block receptors in those areas to the mediators that are being released. And so one of the main therapies is antihistamine, and you're all familiar with those. So that's like Benadryl, over-the-counter Zyrtec, Claritin, Brixoral. There's a whole host of them. And so you want to start, when you can, to go on a non-sedating antihistamine. And they do have two of those available over the counter now, and that's Zyrtec and Claritin. And then there are prescribed antihistamines that are non-sedating, but have a lot of trouble many times with insurance companies covering those. But they have two good ones that are over the counter, and so if those work, either of those would work, that would be fine. The next thing is sometimes you need a decongestant. I'm not a big fan of decongestants because it can raise your blood pressure a little bit and can cause some urinary retention in some gentlemen who have prostate problems. So we try to avoid decongestants if we can. If we need a decongestant, I would prefer to use one that works directly on the nasal mucosa in the form of neosynephrine or Afrin. But you can get in trouble using those because you get to a point where you use them more frequently to keep your nasal passages open, then your nose gets somewhat addicted to it. Then it's hard to get your nose back under control without using them. So if I have someone on those types of decongestants, I always have them on a topically applied nasal steroid. And that's like Nasocort, Nasonex, Flonase. You may have heard of many of those types. And those are applied once daily, and then that will keep those mediators under control that are being released.
So you're saying stay away from Mucinex?
No, Mucinex is fine. Mucinex is a mucolytic agent.
Okay.
And what that actually does is thin the mucus. And that works especially if you're prone to sinus infections, because what happens is the mucus thickens up and then it has a hard time draining. And so if you can go on a mucolytic agent such as Mucinex, which is guaifenesin, is the generic of that, and that will help thin that mucus so it drains like it normally should, because we make probably half gallon of mucus a day in our upper respiratory tract. And we just swallow it. And it's just normal for us to do that. And it helps with other bodily functions, of course. But when it starts to thicken up, then you notice it. And you say, man, what's in my throat? Something's always in my throat, or having trouble getting this stuff broke up. And then that's where a mucolytic agent like Mucinex would be very helpful. Another thing that I'm a big believer in is the use of plain old normal saline nasal mist. And that's, you can get it over the counter in the forms of ocean or air, or many places have a generic form of a normal saline nasal mist. Usually they come in a little squeeze bottle, and if you've been out doing stuff, you come in, just spray your nose and blow your nose right away, just to rinse those things out of your nose. Because that's where it all starts, is in the nasal passages. And if you can keep it rinsed out of there, that makes a big difference.
Question.
Yes.
Is a neti pot, would a neti pot do the same thing?
Neti pots work well too.
Right, did that.
It might be a little more
do that.
cumbersome, but
Right.
but they do work. Now, when you get to the point that the medicines don't seem to be working, and you got to find some, and you're having sinus infections or asthma attacks, or your eczema is severe, then an allergist such as myself may recommend that we start you, after appropriate testing and finding those things that you are allergic to start you on allergy immunotherapy. And allergy immunotherapy is allergy shots. You've probably all heard of allergy shots. And what we do with the allergy shots is we start out with a dilute mixture of those things that you're allergic to. And then each time you come in, which is usually weekly, we build that up. You get a more concentrated shot every time you come in. And by doing that, your body is responding to that, making a new antibody called IgG to compete with the IgE. And so that then shuts down the IgE, and the IgG is a protective antibody to control your allergy symptoms and diseases. And it, after being on allergy immunotherapy for 3 to 5 years, then we discontinue your immunotherapy, and many times it is a quasi-cure for your allergies. I mean, some people never have a problem again with their allergies after being on allergy shots for 3 to 5 years. But you don't go weekly all that time. If we get you built up to what we call your maintenance dose, which is a concentrated dilution of that allergy serum or extract or vaccine that we make, then we will stretch that out to every other week. and for a period, and then we go monthly. And so most of it is done monthly once we get you built up there. And then after 3 to 5 years, we stop your immunotherapy, and we can usually judge by how your symptoms are doing, if you have to use medications, and if you're not having to use medications and your symptoms are controlled, then we'll discontinue the immunotherapy. And 85% of the people will not have any problems after that. There is a few, 10% or so, that will start to revert back to their old symptoms. And what we do at that point is repeat the skin test to see what's changed, and then reformulate an immunotherapy that covers just those allergens. Now, I could go on and on about medications and everything, but I'd like to save some time for questions and answers if we have any, or I could continue to speak. Yes?
So can we ask a question now? Are you opening it up for questions?
Sure, that'd be fine.
Talk about pillows. I have feather pillows, which they say is horrible for allergies. And I've covered them with the zipper things. And can you throw pillows in the dryer like you did, like you
Yes.
talked about the stuffed animals? And also, is there a theory that you should replace your pillows every so many years? Because I'll be honest, I have 2
Not
pillows that
necessarily. If you have it encased in something plastic or vinyl, and they've done studies that looked at feather pillows to see, is it truly the feather proteins that you're allergic to? And guess what it is?
the dust mites.
Dust mites. So if you can encase it in something plastic or vinyl, that should solve the problem. You
Because
know?
I've had some I've had for 40 years. Like, they go everywhere with me. You know, I mean,
they're the best.
Yeah, I mean, but yeah, and you don't want to get rid of them. They kind of help you sleep.
Yeah, and if you can throw those in the dryer, turn the heat up, throw them in there for a while, and take them out, that should kill off the dust mites.
Okay. How often do dust mites come back? Like, would you have to do
Oh,
it once a month?
They populate all the
They're
time.
all the time.
They are microscopic insects that live in the dust. And why I mentioned the bedrooms the most, that's when they come out at night to crawl around on our bodies and eat our, and they love, and their main meal is our dead skin.
Yeah.
And so they eat up that dead skin, and
I don't want to
they,
know how many of those you have in your home.
and then they leave their deposits around, and
Yeah.
and they found that it's an enzyme that they use to digest the skin. That was what we're highly allergic to, and so they leave that all around. So, if you
That's a nice
have
visual.
dust mite allergy, you're sleeping with the enemy.
Yeah.
Yes, ma'am.
So do you think massages and reflexology do help allergies some?
I have no problem with that. I am an osteopathic physician, a DO.
Oh, a DO.
So I've been trained in art of manipulation, and I know the importance of structure and function in the body as a whole. So holistic medicine is very important in all aspects of medicine, and the way I feel. It's because one body part definitely affects another body part. One organ system definitely affects another organ system. So as far as reflexology and manipulation and those things, what you're doing is you're stimulating the nervous connections there that will cause increased blood flow to those areas, and then that will help relieve your symptoms, because you're getting also chemicals to those areas that we naturally make, like endorphins, that take away the pain. And so
I know, because I've been doing reflexology, and I think it's helped my allergies some. I know it's
I'm sure it has.
a lot of the bloating and stuff in my body. You can really tell, you know, and she does it in for hours afterwards to relieve it. So I've been happy with that. I think it's just another avenue rather than, because so many medications aren't covered anymore. You know, like Nasonex and Xyzal and all that stuff, they're not covered by it.
Oh, it's not. That's why I mentioned those 2 over-the-counter ones that you can get.
I just haven't been able to use their technique.
I wanted to mention what I was doing most of my speaking from was, of course, my training. Plus, I wanted you all to have this, Living Well with Allergies, which is a Crames educational production. And they make this through consultation with allergists and other physicians to come up with something that's easily understandable to those not medically trained. So this is a great tool, and I've left those here for you so you all can have one. questions?
Does the dust mites collect with foam pillows also?
They're less informed. They say that those Tempur-Pedic mattresses are supposed to be dust mite resistant, but they still get dust mites in. Those are dust mites.
Okay.
But I have one, and they're enclosed into a cover, the mattress itself. And then you have another one on top. I have a temporary.
And that's supposed to help. That's my understanding. I've not seen the studies on that,
I
but,
like to sleep on it.
but you talk to a salesman, their advertisements, they say it definitely is somewhat dust mite resistant.
Really? Well, that's a good thing to know.
Yes, ma'am.
Do some of the medications, the antihistamines, can they cause ear noises, ringing, and I'm way down on the list of reactions. I found that one, and
Well, you know, on those, when you look up like on the internet or look on the thing that the pharmacist gives you, they're legally obligated to tell you every single thing that could possibly happen with that medication. Now, ringing in the ears can occur. It depends on the medication you're on. Many times if it has some type of non-steroidal anti-inflammatory along with it, then the non-steroidal anti-inflammatory or aspirin or Motrin or Aleve or any of those could possibly lead to some ringing in the ears. But if you could stop the medicine and ringing in the ears goes away, that's great. Then I wouldn't do the medicine again.
yeah,
Because many times once you get ringing in your ears, if it lasts longer than 48 hours, you're pretty much stuck with it.
If you ever had a reaction to a medication, would you have to have it again?
Depending on the reaction that you had. If
Or
you had-
hives?
if you broke out with hives with a medication, I would try to avoid that medication.
Yeah.
And many times, antibiotics are the #1 cause of allergic reactions with medications. And what can be done is, there are so many different types of classes of antibiotics out there now, you just find one that you're not allergic to that will cover the organism that's causing the infection.
In my case, it's naproxen.
Naproxen and non-steroidal anti-inflammatories, you probably should avoid those. And there's a whole list of non-steroidal anti-inflammatories.
If I would have to take it again, I probably would have a reaction.
You probably would have a reaction again. Once you've had a reaction to something, then you're primed, and you'll probably have the reaction again.
Huh. That's
Dr. Radford, talk about the ears again and the itching. It must be really down deep in there because you can't reach. I mean, I just want to take something and just stick it down in there and get it.
It's a common problem with allergies. Many times antihistamines will take care of that, but you know those, especially if you're dust mite allergic, I mean, that stuff can get all over your skin.
So it's down deep.
It
is
can
where it's
get
coming
down,
from then.
it's usually on the outside exterior from your eardrum out, and the ear canals where the itching is occurring.
That
And
doesn't mean the
sometimes it
dust
can be
mites
from
crawl
dry
in there?
skin and from allergens getting into that area, and it's an area that you can't get to. And that's why a lot of times you'll find that when you have allergies, you make a lot of earwax. And that's your body's natural response to that in there, trying to get it out of there. So it makes more earwax and pushes it out.
Are you okay with ear candles?
I have no problem with them if they're used safely. I've never used one. So
You don't have a problem with them?
No, some people like them. They say
The
it
amount of
really
wax
helps.
that comes out is unbelievable.
Really?
Oh,
I would
and it makes a
scare.
huge difference in how my ears feel afterwards, and my
know.
medical doctor has an issue with it.
Well, if you get stuff too hot, you could burn yourself, and you just have to do it
Yeah, we're careful.
the right way.
Okay.
As long as it's done with caution, I wouldn't have a problem with that.
Well, he
And
says you
same
need
as
the
with
wax.
natural ingredients like elderberry concentrate and all those things. I don't have a problem with those. If people find them that is helping, I say it's not hurting you.
But he says you need that wax in there. Don't be sucking that wax out, you need it. Okay,
Well, the
you-
wax it does have a role to collect those things again in your ear and push them out of there. And if you wait long enough, the wax will keep pushing its way out. But some people, you can't get stuff in there, you can't hear, and so you want to get it out of there. So
Don't you think our hair shampoos and our conditioners, that they have all those fragrances in them anymore? cause some of the problems with the ears, and we don't realize how much stuff is in our hair dryers.
That's true. That's all very true. And
Yeah.
I don't have
And
all
we don't get
the
our ears dried out.
information on that, but yeah, you leave, there's all kinds of chemicals in those things
Yeah.
that we can react to. Yes.
Dr. Radford, in studying nutrition, I learned that vitamins A and D are very important for the health of the skin and also for the eyes, but vitamin C, I was understanding, helps the cell wall be less permeable. So personally, I take extra vitamin C if I get a runny nose or anything like that. And then there are some foods that people are likely to be allergic to, and you may have mentioned them while I had to be out. But would you repeat those, the foods that are likely to?
Well, the most common foods and you're looking at pediatric or kids and adult population. Kids, you have to worry about cow's milk, soy, eggs, and wheat or corn. And when you get older, many times we outgrow food allergies, and that's the good thing about food allergies. There's some that you can't outgrow. Those are usually the ones that high protein, like nuts. For some reason, the body has a trouble growing out of a nut allergy. Whereas with all the other allergies, you many times will grow out. Then when you get older, the main food allergens that trouble us are shellfish, nuts, and sometimes some of the grains, but mainly it's the shellfish, nuts, and the big protein. Sometimes beef is in there too, pork.
And milk sometimes for some people.
Milk. Sometimes milk allergy hangs on. And sometimes people can have a condition where you have a lactase deficiency, which is an enzyme that helps digest milk, and they'll confuse that with an allergy. And usually get bloating and diarrhea associated with a lactase deficiency or lactose intolerance. I'm sure you've all heard of lactose intolerance. And it's not a real allergy, a deficient enzyme. But if the common food allergy symptoms are gastroesophageal reflux, can be a big symptom. The immediate symptoms are your eyes get itchy, watery, and your skin breaks out. Your throat gets tight. You have an asthma attack. Those are the most immediate symptoms, but sometimes you can have some delayed things with foods, to include some nausea and heartburn, and diarrhea and constipation. Could be all related to food allergies.
Are there any more questions?
One day it's one thing, and the other day it's another thing.
That's right.
I said, sometimes I think it's because of our diet and what's in the environment. Something will affect you one day, and then it doesn't.
Okay. Well, like I said, it was an honor for me to come over and talk to you about allergies, so the way you could understand them. And hopefully it made sense to what's going on with allergies in our environment, and you'll be able to live better with the allergies that are around us.
Thank you.
Thank you so much for being here.
Feeling good, living life, taking care as we should, following the path you've laid, Holy Counselor. You came that we would have life, O Lord, and have it abundantly. Hallelujah, 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 health.
Reaching out, embracing life, serving joyfully. Just your touch